Good day everyone, I am Jan Queen Enriquez, Section 12F Group 2, and a student nurse from Davao Doctors College. And today I will be showing to you my return demonstration about perineal care. So first, let us know what is the perineum. So perineum is the area between the thighs and from the anterior pelvis to the anus. For the female, it is the area between vagina and rectum, and for the male, it is between the scrotum and anus. And what is perineal flushing? It is a hygienic care that involves cleaning the perineum and genitalia. The purpose of this is to remove normal perineal secretions and odor, to promote client comfort and prevent infection or contamination from the rectum. So first is we will prepare all the equipment needed. So this is to save time and effort. The equipment needed are container with warm water, kidney basin, 7 pieces dry cotton ball, 7 pieces cotton ball soaked in cleansing solution, bedpan, this is to receive rinse water, newspaper to line and cover the bedpan, and the two forceps, which is the working forceps and the clean forceps. So next is we will wash our hands to prevent the spread of microorganisms. So prior to performing the procedure, we will introduce ourselves and verify the client's identity using the two identifiers, which is the name and the birth date. We will also explain to the client what you are going to do and why it is necessary. So this is to let the patient understand the procedure and gain patient's cooperation. So hello ma'am, my name is Jacqueline Enriquez and I will be your student nurse for today. So may I look your wristband, ma'am? Okay. Okay, Mrs. Gonzalez. So today we'll do perineal flushing. So this is to remove normal perineal secretion and prevent contamination from the rectum. So is it okay for you, ma'am? Okay, so I will touch some private parts of your body, ma'am. So is it okay for you, ma'am? Okay, thank you. So we'll start now. So now we'll position the patient on dorsal recumbent or the back-lying position with the knees flexed and spread well apart. So this is to provide patient's comfort. So ma'am, I will now position you in a dorsal recumbent position. Okay. Next is we'll cover her body and legs with the bath blanket position. So a corner is at her head and the opposite corner is at her feet and the other two on the sides. So now this is the blanket. And I will cover the patient's body and legs to ensure that the examined part will only be exposed and the other part will not be exposed. So after that, we will now drape the patient, exposing only the part to be cleansed because the minimum exposure lessens the embarrassment and helps to provide warmth. So now ma'am will now drape you. Okay. And after that, we will inspect the perineum, then flush the perineal area with warm water. We must remember that particular areas of inflammation, swelling, excessive discharge or secretion from the orifice and presence of odor. So I am now inspecting, and so upon inspecting, I have noted that there is no inflammation and also there are no excessive discharge. Before putting the water, we will get the newspaper and the bedpan. So we will now get the sterile water and flush it with warm water because warm water is used to prevent chilling and soften or dissolve blood clots. So we will now get and flush the perineum with warm water. Next is get the 7 pieces of cotton balls soaked in a cleansing solution using the pick of forceps. So this is to maintain sterility. So I have here now the cotton balls soaked in a solution. So cleanses external genitalia starting from midline of symphysis pubis down to the anus. Never retrace a stroke. This is to prevent contamination of the area. So we will start here in the anus, then discard. So with the second cotton ball, cleanse starting from mons pubis in the way of external labium towards the anus, then discard. Secretions that tend to collect around the labia minora facilitate bacterial growth. So we will now get the second cotton ball and clean here. Then discard. So do likewise on the opposite side with the next cotton ball. This is the third cotton ball here. Then discard. So with the fourth cotton ball, cleanse starting from mons pubis by way of internal labium towards the anus. Here. Then discard. So do likewise on the opposite side with the next cotton ball. Here. Then discard. So with another cotton ball, cleanse groin starting from groin going up the thigh. Use another side of the same cotton ball for near groin. So this is for the sixth cotton ball here. Then discard. Then for the last cotton ball, do likewise on the opposite side. So next is flush perineum thoroughly with sterile warm water. So, using the 7 dry cotton balls, dries the perineum with the same stroke as procedure number 8 to number 13. So, the rationale for this is moisture support the growth of many microorganisms. Starting from midline, discard. Discard. Here, discard. Here, discard. Here, discard. Here, discard, and here, discard. So after that, we will now remove the bedpan gently and turn the patient aside. Now, I will remove the bedpan from the patient's buttocks. So, ma'am, move lang to sa side ka dali, ma'am. Okay. Then, we will get it. So, if necessary, take one cotton ball and cleanse one side of the buttocks. Then, clean the other side of the buttocks and dry both buttocks. This is to provide comfort. So after that, turn patient on her back and make her comfortable. So sprays with antiseptic as needed. This is to promote healing. So next is put the perineal pad with an up-down motion as needed. this is to prevent contamination of vagina and urethra from anal area. So next is we will do the aftercare to the materials used. Now I will clean all the materials that we use like the forceps and the bedpan in the washing area. So this is to promote cleanliness. So we will now remove and discard the gloves that we use and perform hand hygiene. So this is to prevent the spread of microorganisms. So, record the treatment done to the patient and any unusual findings such as redness, excoriation, and skin breakdown, discharge or drainage, and any localized areas of tenderness. The rationale for this is for documentation purposes that procedure was done and means of communication. So, ma'am, upon the duration of the assessment, there are no excoriation, skin redness, or any discharge that we observe or assess. So, thank you for cooperating, ma'am, and thank you for being with me during the whole assessment. So, you can now have time to relax and rest. So, thank you again, ma'am.